There is a statue in South Carolina honoring a man who is known as the father of modern gynecology. The inscription on the statue reads, "The first surgeon of the ages, in ministry to women, treating alike empress and slave." Marion Sims was a physician who was born in South Carolina in 1813. He started a clinic in Montgomery, Alabama, and at the time, in order to survive financially, he was a plantation physician where he took care of the enslaved on plantations. Starting in 1845, he started to conduct experiments on enslaved women. The reason that statue is there is that he perfected a technique to repair a condition called vesicovaginal fistula, which basically means that there is an opening between the vagina and the bladder, or the vagina and the rectum, which usually comes after traumatic childbirth. And Sims started from 1845 to 1846, according to some sources, a series of experiments to repair these fistulas. This condition was highly stigmatized and dangerous for these women. There was no treatment. So on the one hand, you could say Sims was doing what doctors are supposed to do by taking these women on as patients. But there's another side to what Sims did. He wanted to be a trailblazing researcher, and these women, their bodies, became props in his journey of scientific discovery. These women were property. These women could not consent. These women also had value to the slaveholders for production and reproduction. How much work they could do in the field. How many enslaved children they could produce. And by having these fistulas, they could not continue with childbirth and also have difficulty working. Anarcha Westcott was a 17-year-old enslaved girl who had just undergone a very traumatic delivery. She was in labor for 3 days. Anarcha underwent 30 surgeries without anesthesia. This surgery was done where black women were naked. Anarcha Westcott was pregnant on the Westcott plantation near Montgomery, Alabama. Her pelvis was disfigured by vitamin deficiencies and rickets. She went into labor in June. The baby was so big that it took 3 days of her being in labor. Her enslaver, called Dr. John Marion Sims, he performed a forceps delivery on her baby, a technique that he had no experience prior to this event. 5 days later, he was called in to examine her after the birth, and discovered that she had vaginal fistula, which is a vaginal rip. He was excited to practice this because he knew this surgery would make him famous. He performed his first surgery on her without any anesthesia because he believed black women didn't feel any pain. He wrote down that she was screaming. She would go through 30 surgeries without any anesthesia, and sometimes other doctors would come in and pin her down during the surgeries. But she was not the only one. There was 2 enslaved women that we know of, Lucy and Betsy. Anarcha experienced more surgeries. After 3.5 years, he claimed that he healed her injuries with silver thread and a clamp suture magnetism that would later be abandoned. He knew of painkillers that could ease her pain during and after surgeries, but he said that the surgeries were not painful enough to justify her struggle. Sims used a shoemaker's awl to pry the skull bones of enslaved women's babies into alignment. These experiments had a 100% fatality rate. Sims often performed autopsies on the corpses, which he kept for further research on the condition. He blamed these fatalities on the sloth and ignorance of their mothers and the black midwives who attended them, as opposed to the extensive experimental surgeries that he conducted on the babies. Now, in history, he is called the father of modern gynecology. The statue in South Carolina says that Sims treated empress and slave women alike. Is that true? Was he treating white women the same way? He did treat white women, but he treated white women with anesthesia. Sims left Alabama in the 1850s and moved to New York City for health reasons, and he started a women's hospital there in 1855. He gained a reputation as an excellent surgeon, and so he did treat white women. but the technique had been perfected on the bodies of Black women. For more of today's and yesteryear stories, please subscribe